When one is newly pregnant, the body is undergoing many rapid changes. One such change is a heavier than normal vaginal discharge that may make a pregnant woman feel damp and icky down there. It is a thin and clear white discharge that has a mild odor. It happens because the body is producing more estrogen, which signals the vagina to produce more discharge. It can begin as early as 1 to 2 weeks after conception, even before the woman has missed her period. One of the reasons for it is the softening of the cervix. Another reason is that the vaginal walls get softer and extra discharge helps prevent any infections traveling up from the vagina to the womb. Later in the pregnancy, in the 3rd trimester, the baby's head presses against the cervix. This is a third reason for this increased vaginal discharge. While the discharge is harmless, it is important to keep the area clean and dry. A purely natural method for keeping the area hygienic is by doing yoni dhupan twice a week. Yoni dhupan means fumigation of the vaginal area with smoke of the medicinal herbal mix Triphala. Another good habit is wearing loose, breathable clothes, preferably of cotton and natural fibers. Every pregnant woman should dry her genitals and pat them with a towel after showering, swimming, or exercising. Using a good perineal wash is also recommended. It is important to note that not all kinds of vaginal discharge are harmless. Let's look at some that may need the doctor's attention. White or off-white discharge resembling cottage cheese can indicate a yeast infection. During pregnancy, the body is particularly susceptible to them. Other symptoms of a yeast infection include itching, burning, and painful urination. Green or yellow vaginal discharge is not healthy and suggests a sexually transmitted infection such as chlamydia or trichomoniasis. Other possible symptoms include redness or irritation in the genitals. Grey vaginal discharge may indicate a vaginal infection called bacterial vaginosis, particularly if it has a fishy smell. Brown discharge is caused by old blood leaving the body, which can be an early symptom of pregnancy. Brown discharge during pregnancy is generally not a cause of concern. Pink discharge during pregnancy may or may not be normal. Discharge with a pink hue often occurs during early pregnancy or in the final weeks when the body prepares for labor. It can also occur before a miscarriage or during an ectopic pregnancy. It is advisable that the pregnant woman writes down the details of the vaginal discharge, when they began, and what exactly she noticed. This will help the doctor determine if the discharge is a cause for concern.